Hi, class. Thank you for tuning in to the discussion number three. First off, I'm going to start off, of course, with the questions and then elaborate on my answers. What impacted me most in my readings is learning more about the ACA, the Affordable Care Act. Yes, it allows everyone to sign up for health insurance. It expanded the Medicaid program for elders and implemented some key factors to do away with insurances denying coverage due to pre existing conditions. Once there's coverage, individuals will have access to necessary care without regards to artificial annual or lifetime expenditures caps. A guarantee that once insurance coverage is in place, it cannot be rescinded except for fraud and many other reasons listed in our textbooks. Titelbaum and Walensky, page 107. I am for the ACA because there are many things implemented that are great for us. However, I still believe there's a lot of work that needs to be done. This is just the beginning. What has most changed about my understanding of healthcare policy and law? I would have to say the fact that without policy and law, healthcare would be a lost cause. Without the structure, the guidance, and the overseeing of healthcare policy and law, healthcare would be a huge disaster. In order to have order and a well structured plan, healthcare policy and law is a must have. The core foundation of healthcare is policy and law. Without this structure, anyone and everyone would make their own rules as they go. The rules would change all the time. Healthcare would quickly spiral out of control. It is inevitable that we keep healthcare policy and law as the foundation and overseer of healthcare. How can I see what I've learned impacting me and my family? Having access to insurance doesn't necessarily mean we can truly afford to use it. I see many patients entering our cardiologist office on a daily basis with insurance. However, they complain about their copayment. Many will state they're on a fixed income and can't afford to pay their insurance costs. Most of those insurance costs is anywhere between 25 to 35 or maybe even $45. There are also those that need procedures done. However, they can't afford the out of pocket costs remaining after the insurance has paid their portion. I work for a small practice. We all know the smaller the practice, the more expensive insurance premiums are for the individual. Some of us simply can't afford to add our families to our insurance, and we work every day. There's still a lot of work to be done with our healthcare system. Somewhere where in between policy and law, there should be a consideration for dignity and worth of the human being. How has 2015 annual health reform update affected healthcare policy and law, particularly as it relates to the topic I have selected? There has been a tremendous decrease of uninsured individuals in the U.S. Policymakers should continue to capitalize on the positive factors of the ACA to continue implementing and developing new innovative ideas to help the quality of healthcare for individuals. In my opinion, it is a great starting point, and a lot of great things have been implemented and achieved. I think there will be even more greater things and changes to come in healthcare. Thank you for tuning in. I hope my message was educational and very informative, and I appreciate your time. Thank you. Have a great day.